Hi dear doctors, welcome to Kidscovery. We are discussing the syndromic patterns which are seen in pediatrics age group, and this class is specially dedicated to a syndrome that's important, that's called as Charge syndrome. Little glitch from my team is they have mentioned here pediatric infectious disease, whereas this class belongs to pediatric syndromes. I hope they have rectified in the workbooks being provided, but then yeah, this is the pediatric syndrome class. So what is charge? Let me just show you with the example. Yeah. So see, actually for the coloboma. So what is coloboma? If you compare the pupil, can you see that the pupil is slightly enlarged over here as compared to this? Okay. So the iris is actually normal in this case, whereas iris is not formed in this. So coloboma is actually somewhere related to your iris malformation. Okay. So there's malformation in the iris. So C for your coloboma. Okay, C for what? C for coloboma. So one thing I have told you, coloboma of the eye. Sometimes there is a CNS abnormality. So if you have seen my video of vectoral abnormalities, in the end I asked you a question. So the correct answer to that question is this only. That is called as Charge syndrome is going to present with the CNS abnormalities. So IQ is IQ in most of the patients suffering from Charge syndrome is not normal. Then of course Charge syndrome has got heart disease. There is choanal atresia which is going to be there. So choanal atresia, that means there will be nose problem which is going to be there. Okay, so choanal problems or the nose problems are going to have been there. So there will be choanal atresia which is going to be there. Then of course there will be retardation of growth and retardation of development. IQ is something which is less in these patients. There are genital issues. There is hypogonadism and some ear problems also which can cause the deafness as well. Okay, so these are the important parts. The facial features, although facial features are not mentioned in the Charge syndrome, but it has been seen that these patients will have a high forehead, they'll have downward slanting eyes, they'll have a narrow face, they'll have a pointed chin. Okay, leave the slant, but other things please keep in mind. Of course there will be ear abnormalities which are going to be there. Okay, so I think I have told you about the Charge. Let's quickly revise, but before revising let me just tell you this is a CHD1. Okay, so there's a city, the capital city of Haryana and Punjab, that is called as Chandigarh, and we write Chandigarh in short form as CHD. So you can remember CHD, CH for charge. Okay, Charge syndrome or Charge disease, and please remember this. Okay, this is important. So of course revising it for you: coloboma, heart disease, choanal atresia, retardation, genital hypoplasia, and ear problem which is going to be there. Charge disease. Okay, so this is A. Yeah. So diagnosis. So in Charge disease you have got char. Now char in Hindi is a Hindi word for 4 in English. Okay, so 4. So that means you need at least 4 clinical features out of all these 6 features, the 5 features, to call it as a Charge syndrome. Now the question which they ask, like what is the main feature which is seen in the Charge syndrome? So C for coloboma. Yes, of course that's the main feature, but other ocular features like nystagmus and microphthalmia is also seen. So if you can remember coloboma, that's fine. Other features are also there. See, for cardiac, the most important cardiac feature is actually VST. Of course PD and pulmonary stenosis are also there, but VST is something which you have to remember. Then we have got something which is called as the ear abnormalities, that is actually semicircular canal hypoplasia. Okay, so malformation, you can write semicircular canal hypoplasia which is going to be there. Okay, so A for choanal atresia, which we have discussed. What is the problem in CNS that was combined or coupled with coloboma? CNS can show you the nerve defects like 1, 7, 8, 9, 10 defect. Okay, these things can be having the problem. In genitourinary system, cryptorchidism is the most important one. Otherwise micropenis and hypospadias is also something which is going to be there. Okay, so this charge is actually a negative charge. Negative. Why negative? Because everything is getting ill formed, like testes are formed but not coming. Cryptorchidism. Then hypospadias means urethral opening on the ventral part. Micropenis, decreased growth. All these things can occur. After that, in investigations, please understand, we have to check the karyotype, we have to check the CHD, And for the ear defects, for the eye defects, you can do an MRI of the skull. And postnatally, you can do MRI for inner ear and ocular defects, and cardiac and ENT evaluation. So management is actually multidisciplinary. You have to incorporate different subspecialties has to be incorporated to keep the CHARGE syndrome patient in a better state of development. So thank you so much for watching CHARGE syndrome. I hope you are very much recharged and studying well for your exams. Thank you.